Hi, my name is Wilma Varela, and today I'll be talking about colonoscopy. Colonoscopy is a procedure that is done to enable the visualization of the colon for colon disorders. The reasons that a patient might need to have a colonoscopy done is basically to screen for colon polyps and which is a growth of tissue in the colon, or colon cancer, rectal bleeding, changes in the bowel habits like persistent diarrhea, iron deficiency, anemia, and other colon dysfunction. Beginning at the age of 50 and continue until then, until the age of 75 is when a patient will need to be screened. So this is an image of the colonoscopy. It's a 4-foot long flexible tube that goes in the colon, and there's a light in it to allow the visualization of the inner aspect, and the physician is able to see the image in a big screen. Now, the colonoscopy is done by a physician, but the nurse's role at the beginning of the prior to the procedure is to basically perform an assessment of pain, vital signs, skin appearance, medical history, drug history, and any concerns that the patient might have, and also assess for the airway of the patient as well. Now, after the procedure, the assessment that the nurse needs to do is similar to that before the procedure. It includes vital signs, pain assessments, any unusual event that might occur during the procedure, and reports of patient's disposition. And the nurse needs to also educate the patient and leave the patient with any discharge information that they need to go home with. Now, the Cancer Association recommends that a patient that is 50 years old and older, man or woman, needs to do one of these following tests to test for polyps in the colon or cancer, and one of these tests does include the colonoscopy, and they recommend it to be done every 10 years. Other tests that the patient might consider is a visual colonoscopy, which is the TC, every 5 years, and fecal tests, also stool DNA tests, and other tests that the patient can do to detect any abnormalities in the colon.